So we're here with Russell Metcalfe-Smith, manager of the Cedar Sinai Women's Guild Simulation Program for Advanced Clinical Skills. So Russell, can you tell me a little bit about who you are and what your background is?
Well, my name's Russell Metcalfe-Smith. I'm a paramedic from the United Kingdom. I've worked as a rapid response paramedic for 15 years and was previously clinical lead for resuscitation services and head of the simulation centre in Croydon in southwest London, which was a large 1,000 bedded university teaching hospital. So I had an incredible interest in resuscitation. I did quite a few postgraduate style courses once qualifying as a paramedic, and started off teaching the public resuscitation type skills, mainly primary care physicians, community nurses. Then moved into a mental health hospital where I was responsible for 98 different hospital sites, and again looking at all their resuscitation policies and procedures and training. And then after a 12-month contract in that hospital, I moved into like I said, Croydon University Hospital, and was there for about 10 years. About 3 years into that job, I had a fantastic idea to open up a simulation centre. 2 years after that, after much fighting and business plans being knocked back and resubmitted and knocked back, the simulation centre started being built, and then consecutively over a number of years it became very, very successful. It won awards annually, and hence now I'm here in the US.
All right. Funding come from for the Cedar Sinai Simulation Center. Who did you work with, and how did you develop a plan to create the program?
Okay, so the Cedar Sinai Medical Centre opened up a brand new advanced health sciences pavilion, which has been funded by the organisation. Its exact source of funding I'm not entirely aware of, but I do know that the organisation felt that there was it would benefit from having a centralised location for simulation-based training, as it's something which has taken place within the organisation for many years, but in many different parts of the actual organisation. So planning for this actually started well before my appointment, and really I turned up at a time when the money was available. There was an idea of the equipment which was required, and there was an empty shell which I had to kind of fill. So I went through a process of purchasing all the equipment for the centre, for recruiting the staff, and putting together policies and procedures, and moving to the stage we're at now.
How did you come to the conclusion on which vendor to go with when purchasing equipment?
That's a really good question. So we've gone with multiple vendors depending on the equipment which we need to use. So we use Symbionix for virtual surgery. We have a different laparoscopic provider, which I can't recall the name for. We've got a surgical Da Vinci type simulator with Mimic. We have a number of Lerdell part task simulators, area management simulators, sort of intraosseous devices, pediatric airway heads. We went with Gormard for all of the human patient simulators. That was purely based on its ability to interact with real medical equipment, which is something which I want to achieve here in the centre, where we remove the need to suspend reality, because I think the simulation centre here it's not a simulation centre. I guess that's a really good term to use, because it's actually a real clinical environment with real clinical equipment that reflects real clinical reality within the hospital. So therefore, if we have simulators which can connect to real medical equipment, Gormard is the only supplier which manages to achieve that level of fidelity.
What were the key elements in creating a curriculum for a hospital-based program?
As a manager of the simulation centre, as the health systems manager for that at Cedars, my role is to encourage the greater use of simulation across the organisation. So we work with educators, whether they're physician educators, nurse educators, whoever that might be, to try and encourage them to adapt their programs to incorporate simulation into their curriculum at a much greater level. And I think we've been very successful. We've got about 22 different programs now using the centre. And I think from data, I'm talking off the top of my head here, probably between 1,500 and probably 2,000 users a month coming through the Women's Guild Simulation Centre.
How does your background in EMS help create a simulation program?
How does my background in EMS help? I think, I'd say in some ways it doesn't, because I think much of the simulation we do here is so specialised and intense that actually it gives a basic understanding of some of the physiology, but actually some of the simulations are so intensive and area specific that actually we need to bring in professionals from that particular area. Hence why when we looked at staffing the centre, we felt it was more important to staff it with technical staff than clinical staff, because no clinician would have the broad medical knowledge required to enable them to act as an expert in all clinical areas. Does it help coming from EMS? I think a background in EMS is extremely beneficial in that it exposes you to a huge amount of life experience, and I'd say it certainly helps in your communication skills. And certainly working in London, it's the busiest ambulance service in the world. It's answering 4,500 emergency calls a day. I've been to quite a selection of incidents, and I think it being in a unique position, the clinical specialist in resuscitation role is quite unique in the UK. So I've spent 10 years going to cardiac arrest, so I'm very used to the in-hospital clinical environment and the out-of-hospital clinical environment, and very used to taking a leadership role in both.
How did you select your staff, and what backgrounds or strengths were you looking for?
I was looking for technicians who had a wide variety of roles, and when I'm saying technicians, I could be using simulation specialist or operation specialist or anything at all. It's just a title I'm using to describe the people I want. We've got a huge amount of different types of technology, so I need people with a diverse range of skills that can operate that technology. So what I don't need is a computer expert or an AV expert or an EMS expert or a nurse expert. I need somebody that's got many varying skills, and some of those individuals will have greater skills in some areas rather than other areas. So it's very much down to what we need as a centre and what the needs of the programs are as we're developing. Hence why in the recruitment process I've been very careful about the type of people and skill sets that we're bringing on board on a permanent basis.
What resources does Cedar Sinai offer to the simulation community?
What does it offer to the actual community? A community in that users of the centre, or community in that other technicians?
Other technicians, other programs that are starting. Does Cedar Sinai offer anything to programs to help them get started or maintain their programs?
I think certainly there's a huge amount of interest in the Women's Guild Simulation Centre. It's probably one of the most technology intensive centres that exist. I would imagine internationally, not just in the US, but it's an incredible facility with a huge amount of resources that are available to not only the staff internally, but also staff associated with the medical centre as part of the kind of Cedars group. We conduct a huge amount of tours and have a huge amount of interactions with other hospitals, and I think just giving them our experiences and discussing what mistakes we've made and what positive things we've done is probably our biggest interactive role. We're also producing a lot of faculty development programs, programs for simulation specialists, and I think that's an exciting new route that we're going down.
Please describe what your largest obstacles were and how you overcame them.
I think my largest obstacles were deciding what not to buy. There's a huge amount of equipment, and you can go on forever buying equipment because this is a real clinical environment, but it was kind of putting a restriction on what do we need to do, what we need to do, and what don't we need to actually purchase. So I think it's very easy to be given a pot of money, but it's actually quite difficult to decide what do you actually need to do, what you want to deliver. And I think every organisation is different in what its users' requirements are. and that for me was meeting the challenge of what the end users wanted to achieve.
Describe where you feel your program is now and what are your future goals.
I think we're hitting about, like I said, 22 different programs across the organisation. I imagine we're hitting 1,500 to 2,000 people a month using the facility. I'd like to see that over the next 18 months hit in the region of 3,500 people. I think if we're hitting between 3,500 and 4,000 people a month, we're probably going to be nearly at capacity for what this venue can actually deliver. And I think that's my immediate goal, to ensure that everybody within the health system has got access to simulation as part of their educational repertoire.
Great.
Nice to meet you.
Thank you very much, Russell.
Thank you.